Hand hygiene, I've identified my patient, I've provided privacy. I'm going to remove a bandage from him. I've got clean gloves on. So my bag is in my kit, which I don't like that, but I don't know if all of them come like that. So I'm going to open my kit away from me, and I'll go ahead and set up my sterile field, which involves grabbing a little piece of this and kind of shaking it out by its edges, putting it on the table. Now, I don't know if you can see me. I'm just going around so I don't reach over it. And I'm going to grab the bag out of my kit because I'll need it. And I'm going to roll the top of the bag down. Put it somewhere by my patient. So I'm going to put the dressing in it. So when I remove his dressing, I'll assess his pain level before I even start. And if it's okay, then I'll go ahead. And so I'm going to take, I don't have a dressing on him right now, but if I did, I would work the tape up, kind of pull or push the skin down as I'm pulling the tape up, kind of just slowly, easily work it off towards the center of the bandage. And then whenever it's off, I'm going to look at the drainage from it. And I'm trying to not let the patient see because they'll freak out sometimes. So then I'll do it one layer at a time, look at the drainage on each one, and discard it in my bag I have here. And then I'm going to, after I remove the old dressing, I'll go ahead and remove these gloves kind of like this so I'm not touching them. And then perform hand hygiene again. And I'm going to put on another pair of just clean gloves, not my sterile gloves yet. So another pair of clean gloves. And I'm going to get ready. Before I do that, I'm going to actually assess the wound. So like, you assess the wound, you just kind of palpate around it, make sure it's got that healing ridge, look at the color. We've already looked at the drainage of it. If it needs to be irrigated, I would do that at this point, I guess. Actually, I'd probably do it after I did my sterile stuff. But, so no, I wouldn't irrigate it yet. But, assess the wound. And after that's done, I'm going to take off these gloves. And then do some more hand hygiene again. Just have powder all over them. But do my hand hygiene. Then I would create my sterile field. But I had to get my bag out of my kit first. So I've kind of already got this down. And I've been trying to not reach over it because that can break sterility. Oh, before I threw these gloves away, I'd actually throw all of this away. Or move it at least out of the way. But anyways, so I've got my sterile gloves here. Put these on. Put them upside down. And then the way I'm going to put these on, I just don't have a lot of room here. But the way I'm going to put these on is I'm going to start with my dominant hand. I'll grab it by the inside cuff. Work my hand in there. Don't let the outside touch my hand. Like this. I'm just kind of pull it up like that. And then for the other hand, and slip my two fingers under the cuff, and then work my hand in there without letting it touch my bare hand touch the outside, outside of the glove. And I have that done. And we'll pretend like this is on another table, but I wouldn't do this in real life, but I just don't have enough room here, so I'm just going to move this out of the way. But if I actually did that, it would break sterility, so we're going to pretend like I have more room than what I actually do. But anyway, so I've got my patient ready. I've got my sterile filled out already because I had to get the trash bag. And I have some ABD gauze in here. I'll set towards the middle of the sterile field because I've already touched the edges. I've got some 4x4s in here. They're wrapped with something. And then some rolled up gauze. And I'm trying not to reach over this field. I'm going to the side of it. Rolled up gauze. I've got tape. Some more tape. And then I've got some saline solution. Okay, so now I would clean his wound with whatever the doctor ordered for me to clean it with. If it's like an incision that's just going straight down, I'm just going to do like a swab or even like some tweezers and a cotton ball and some solution. And I'm going to just go in one direction, throw that cotton ball, I guess in my trash bag. Yeah, in my trash bag, and then do that. But I'm going to do it each time. I'm going to go same direction, and I'm going to use a new swab. If it's around his drain, I would start towards where the drain hole is and go in circles, but work my way out. That way I'm not going over the same spots again, because that's not clean. And let's see. If it was a deep ulcer, I'd probably just irrigate that out. And then also you can go from, you always want to go away from the incision, like with the drain, how I was going away from it. So you don't want to go over the same spot again with your swab or cotton ball or whatever you're using. And so you clean the wound. If it were an ulcer, you pack it. So I'm guessing that's what this is for. I would pour it in my tray, soak some gauze pads in it. I would pull the gauze pads up and put it in the wound, pack it in there, and then any tunnels that the wound has, making sure it does not go over the edge. So for a dry wound, just I clean it, okay, and then blot it off with a gauze pad. And put some more dry gauze over it. Place my ABD pad over that. I wouldn't touch the patient's gown because that would break sterility. But just for this video, I had to move it. And then to tape it, let's see. I should use a bigger patient. Tape it. Perpendicular to the wound. Pretend his wound's going that way. So I'm going to leave a little bit of that tape hanging off. This is not. It's sticking to his gown. My patient's too little. But anyways, I would do one on each edge, kind of hanging off the edge a little bit, so it's going to have room to stick to his skin. And I don't have enough tape here, but if I did, I would put one over the middle also. Okay, and then remove my gloves, my sterile gloves. I would do hand hygiene. I'd put on a new pair of clean gloves and clean up my mess. Discard of everything. Get my trash, take it to the, probably the biohazard. It's red. It's got blood and stuff on it, so I'd take it to the biohazard. And then I would make sure that the patient had his call light and everything that he needed, make sure he's comfortable.